In this video, we are going to talk about prostate and lower back pain. Can back pain be a symptom of prostate cancer? Symptoms, risk factors, diagnosis, treatment, and screening for prostate cancer. Welcome to Medical Made Easy. Advanced prostate cancer involves the metastasis of cancer cells from the prostate to other body organs. Usually, these cells start out spreading to the bones. Medical professionals call this bone metastasis. In the event that the spine is impacted, back discomfort could arise. Can back pain be a symptom of prostate cancer? Prostate cancer and back pain may be related. However, the condition is not always indicated by back pain on its own. If prostate cancer spreads to the bones in its later stages, back pain is most certainly related to the disease. Hips, ribs, and spine are the most common locations for metastatic prostate cancer. This can hurt and typically appear in stage 4 prostate cancer. As many as 6% of males with prostate cancer have bone metastasis. Symptoms: depending on where the cancer is located, back pain brought on by prostate cancer that has migrated to the spine may exhibit some of the following symptoms: stiffness in the back or neck, difficulties walking, decreased sensitivity to pain, cold, and heat, numbness, weakness, or tingling in the arms or legs. Discomfort worsens with movement. Risk factors. The main cause of back discomfort is a malignancy that spreads and becomes metastatic to the bones, especially the back. Also, aging is a major risk factor for prostate cancer in general and can also be a factor in back pain. Males under 40 are not often affected by this type of cancer. According to the American Cancer Society, males over 65 account for about 60% of cases. Approximately 66 is the usual age of diagnosis. Researchers are unaware of the reason for this additional risk factor for prostate cancer. Ethnicity. According to the American Cancer Society, men of African American and Caribbean descent who have prostate cancer are more likely to have it. Additionally, these men are typically younger when prostate cancer initially manifests compared to non-Hispanic white persons. The disease is less common in Asian Americans and Hispanic or Latino males. A person's risk of contracting the illness may also be raised if they have a family member who has it. Additional risk factors for prostate cancer could be an unhealthy diet, obesity, or exposure to specific toxins. Diagnosis. A doctor may request X-rays to ascertain whether a patient's back pain is associated with prostate cancer. These could show the ivory vertebra, which is denser, more opaque bone tissue that typically occurs because of breast or prostate cancer that has progressed to the spine. A computed axial tomography (CAT) scan or magnetic resonance imaging (MRI) can reveal any disease or damage to the ligaments, discs, and other soft tissues that may be the consequence of prostate cancer that has metastasized. A bone scan can also be used by doctors to diagnose bone metastasis. A tiny amount of radioactive dye must be injected into a vein. In order to do this, after that, the technician uses a specialized camera to scan the patient's body, and the dye makes it easier to see any potential cancer-related bone damage. Treatment: as an individual suffering from bone discomfort and prostate cancer is able to use painkillers, non-steroidal anti-inflammatory medications, and NSAIDs that can be purchased over the counter, such as Aleve or ibuprofen, Advil, may be able to treat minor back discomfort. Stronger painkillers may be prescribed by a doctor for moderate to severe pain. Other popular therapies for back pain include using heat or cold packs, doing low-impact, moderate stretches and exercises, engaging in physical therapy, and taking calcium and vitamin supplements to maintain strong bones. In more severe situations, a physician might advise transcutaneous electrical nerve stimulations, TENS, nerve block, bone grafting to support a broken bone. But treating cancer itself is the best course of action for treating any kind of cancer symptom. It is therefore advisable for a patient to speak with their physician about the safety of using painkillers, in addition to cancer treatment. For those who have prostate cancer, there are several therapy choices available. Among them are prostatectomy. In this procedure, the prostate and some surrounding tissues are removed. Radiation therapy. In order to eliminate discomfort and destroy cancer cells in the spine, tailored radiation beams are used. Bisphosphonates to reduce pain and slow the growth of cancer cells. A doctor may inject medications intravenously such as zoledronic acid, Zometa, radiopharmaceuticals. A physician can use these medications to target and eradicate cancer cells in each damaged bone at the same time if cancer has spread to more than one. Other causes of back pain. Back discomfort is a highly common medical complaint, especially when it is short term. The following conditions may be the cause: sprains or strains, overexertion, injuries, spinal stenosis, pressure on the spinal nerves, sciatica, abnormalities of the spine such as scoliosis, arthritis, and other inflammatory diseases, kidney stones, infections, abdominal aortic aneurysms. However, it is advisable to consult a physician as a precaution if a person has a persistent backache and also has prostate cancer or is more likely to get it. Back pain is a frequent ailment with a wide range of potential causes and explanations, ranging from kidney infection to muscle strain. Approximately 1 in 8 men will receive a prostate cancer diagnosis at some point in their lives, and 1 in 6 African American men are at a higher risk of getting prostate cancer. Age has a role as well. Males over 65 are more likely to be diagnosed with it, although males under 40 are not as likely. Your risk for prostate cancer is also influenced by your family history, particularly if you have a father or brother who has been diagnosed with the condition. Prostate cancer, like other malignancies, responds much better to early detection. Regular screening involves a digital rectal exam and a blood test to determine the level of a protein called prostate specific antigen PSA, which is typically performed by your primary care physician. According to national guidelines from the National Comprehensive Cancer Network, males at high risk, African Americans, those with a family history of prostate cancer, and those with a known genetic mutation associated with prostate cancer should start having PSA tests at age 40. At age 45, men who are at average risk should start testing. In the event that your PSA readings and physical examination raise suspicions about prostate cancer, you will likely be referred to a urologist to discuss your options for a prostate biopsy and future measures. Instead of beginning treatment right away, active surveillance is a choice for many men with low risk, early stage prostate cancer. This strategy, sometimes known as watchful waiting, entails routinely checking for cancer growth using magnetic resonance imaging, PSA testing, and, if necessary, biopsy. This enables men to delay and potentially prevent the side effects of treatment for a cancer that is not expected to spread or create any issues. That's it for today's video. If you liked today's video, please do not forget to hit the like and subscribe button. Until next time, stay happy, stay healthy. Bye bye.